Thank you for joining the Two Minds Connect podcast, sponsored by Canyon 3D, with your host, Benny Martin and Ty Canyon. Do you have a need for 3D printing products and services? Look no further. Canyon 3D is a retailer of 3D printers from companies like Creality and ANET, along with being producers of our own PLA filament in over 50 colors and patterns. We also have a wide selection of 3D printing resins from Applied Lab work that are built for Formlabs, Anycubic, and Moai printers, just to name a few. We are also a 3D printing service bureau specializing in stereolithography and FDM technologies, using only the best professional 3D printers to produce virtually any model. So whether you need a medical, dental, or general purpose model, we've got you covered. So check us out today at www.canyon3d.com. Place an order using the promo code podcast and get a 15% discount. This offer won't last, so act fast to take advantage of this special offer. Peace. Hey, what's good, everybody? This is Ty Canyon from the Two Minds Connect podcast. I want to thank everyone for joining us today. Unfortunately, my man, my ace, my partner, Benny can't make it this week, so I'm going to host solo. And to keep with the theme and the title of our show, I have another mind to connect with on the podcast. So today I want to introduce to you a man who has done a lot. He's an author. He's a public health professional. He's an infectious disease behaviorist, which we're going to talk about what that is in a second. He's testified in front of Congress about various issues, been on CNN, been on Fox News. He's an entrepreneur as chief executive officer of his great company, Safer Behaviors. Not to mention all the other great things that he's done over his career. And I would spend the rest of the hour talking about all this man's accomplishments, but I think you guys are going to get tired of listening to my voice. So without further ado, I'm going to introduce Sean Kaufman to the show. Thank you for joining us, Sean.
Hi, thanks for having me, man. It's great to see you. It was good talking to you and Benny. I will miss Benny too as well. So it's funny because you're kind of stuck with me, but you and I both like to talk.
Oh yeah, we're some talkers, and the listeners to the podcast know I love to talk. I love to ramble. So let's get to it. And then of course, when Benny's available, perhaps we can have you back on, and we could talk a little bit more about some things that he may have wanted to touch on. But for today, yeah, we'll just be me and you, and we'll get to it. So let's talk a little bit about your background. Tell us about yourself. Where are you from? What got you into pursuing a career in public health?
Well, no, to be honest with you, I at a very young age, when I say young, I was in college, and yes. And keep this in mind, my father was a Marine Corps officer, mm-hmm. and I fell in love with HIV. And I know that sounds weird. I mean, the fact that there was a virus at the time that had no cure.
Right.
The fact that this virus could enter your body, could actually rewrite your genetic code and produce itself throughout your body and go literally 10 years without you being able to detect it, mm-hmm. Was something that I fell in love with. It was a incurable disease at that time, which meant that there was nothing really doctors could do for you.
Right.
And so behavioral scientists, or people who had studied behavior and focused on behavioral modification, those were the individuals that really assisted and worked during that pandemic situation, during when HIV couldn't be managed. Mm-hmm. And so I fell in love with that virus. And I remember, my father, being a Marine, during that time, HIV was so strongly stigmatized.
Oh yeah.
You were either gay or you were a drug user.
Right.
And so my father was, we had this dinner, and you were, Ty, I know you're a former military guy. Mm-hmm. And we used to have this dinner table that we would set only for 3 occasions. It would be kind of like, for holidays.
Right.
Dad got orders to move the table.
Yes.
And I came home one day and the table was set, and I'm thinking, wait, I'm in college. I don't really care now. Why are they setting this table? And it was a table setting, believe it or not, Ty. My mom and dad sat at the table and they said, son, are you gay? We'll love you if you're gay. It's okay. Are you gay? And I was like, Dad, Mom, no, I'm not gay. Mm-hmm. And they said, son, Are you HIV positive? And I'm like, no, mom and dad, I'm not HIV positive. And then they said, well, then son, why are you wanting to work with this virus and people who are sick with it? And you have to keep in mind, and the reason why I bring this up, Ty, is the stigma was so strong back then with HIV, and we're starting to see people being stigmatized now.
Absolutely.
And I'm sorry, I'm going to call it straight out what it is. It's also discrimination.
It is.
People are being discriminated against.
Totally.
When someone says, what's your vaccine status? And based on a vaccine status, they're going to either deprive you of care, deprive you of an education, deprive you of a job. That's just flat out discrimination.
Absolutely.
Flat out. And it's wrong. So anyway, it's a long way of answering your question, but that's what got me into public health. I fell in love with that virus. I've had the privileges of working at CDC. I've had the privilege of working at Emory University and starting my own company, and really truly to work around it, to teach people how to work safely around infectious disease. That's our specialty.
Absolutely.
It doesn't matter what you know. It really, you may know the speed limit, but you don't follow it.
Right.
Really is about what you do. How do you work safely around these infectious diseases so that you can go home at the end of the day and we know you're going to stay healthy, your family's going to stay healthy, and you're not going to cause this massive release to society. Yeah,
absolutely. And let's unpack that for a second. So we're talking late 80s, early 90s. I'm assuming is the time frame that you're talking about. I was like a preteen, before, I was like a preteen during that time. So I remember seeing all the commercials about HIV and all the shows, the Hollywood just ran with that, all the TV shows that had themes about people with HIV and people with AIDS and things like that. The movie Philadelphia came out in 93 and that was a big thing. So that during that time, I mean, yes, it was very, very stigmatized. What are some other situations you've seen, maybe in your personal life or just, maybe through back channels where you've seen people being stigmatized due to the COVID situation?
Oh my, well, I mean, we could start with HIV, but then let's go to the 2001 anthrax attack.
Right.
All right. There were postal employees who were exposed to anthrax. When family members found out that they were exposed to anthrax, even though anthrax is not transmissible from one person to another, family members would reject other family members. They were too scared to get around them. And children also were stigmatized at school. When they found out that their parents were postal employees, the other kids wouldn't get near them or wouldn't want to play with them.
All right.
So infectious diseases, I could give you examples of H1N1, the original SARS. I mean, come on. Chinatown in 2003, Chinatowns across the country were shut down from SARS coronavirus 1. What, did this virus only pick on the Chinese?
Right.
Come on. I mean,
back to the discrimination piece.
Listen, stigma follows fear. When we fear something, we begin to stigmatize it.
Right.
And we then do the best that we can to stay away from it. And that's the weird part right now. I mean, I'll be honest with you, Ty. The saddest part about what I'm witnessing today with COVID-19 and what's happening is that while the politicians, big pharma, and the media, and I include social media on there, are all working together. I mean, they are collaborating. They are working together. The healthcare workers, the public health professionals, and the scientists are attacking each other. So explain that to me. The group that can actually save people from this pandemic threat, to minimize the threat, they're actually fighting each other, while the ones that are profiting from it, the politicians, big pharma, and media, the ones that are they're partnering. So it makes no sense to me. If we really want an end to this pandemic, you need to tell politicians to get the heck out of it. Stay out of it. My health and my well-being has nothing to do with your job. Go talk
public health issue.
Exactly. Media, tell the truth. Stop playing your narrative. And big pharma, my goodness, come on. You can do better than right now. I mean, look, I'm not big pharma as an evil entity, because they're not. They do great science, and there are many lives. They control diabetes. They provide solutions for heart disease. They provide hope for cancer patients. Look, I'm not going to paint big pharma as bad people. They're not, but they can do better.
Absolutely.
Out of the millions and millions and millions and millions of drugs that exist, there are some that can be repurposed and used to fight this pandemic. And so, I'm not going to let big pharma off the hook. but I am going to give them a compliment, but at the same time say you can rise up and be a bit better than you are.
Yeah, most definitely. And just a little bit of background of how we met. So you were actually on an event on LinkedIn that I happened to tune into it. I got an invite, or I got notification that another follower or someone that I'm connected with was going to this event. And I was like, oh, that seems interesting. So when I, heard you talking and heard you just speaking with such candor and such passion, I was like, man, I got to connect with this guy, because we share a lot of the same beliefs and the same opinions about this topic. So what I like to know is what are some endeavors that you're doing to raise more awareness about what you just spoke about how we can't have, there's infighting in the industry, and then there's the political aspect, and now the media aspect. Can you give us some insight into some endeavors that you're doing to bring more awareness?
Well, to be honest with you, it's really tough, Todd. And here's what I mean by that. And at no time in my 25 years or over 25 years in public health have I ever wanted to give up on public health, but I do now.
Wow.
I'd like to retire and do something else for a living because I'm embarrassed.
Yes.
I'm not embarrassed of the public health professionals. Please don't get me wrong. Hear me out on this. Public health professionals have served as they always would, with courage and commitment. It's the public health leadership.
Absolutely.
It is completely compromised. It has been misleading and misinforming people throughout this whole pandemic situation. And so what I'm trying to do, what I'm doing with you on LinkedIn, and a lot of people don't like it. A lot of people really don't like it. I gave a lecture yesterday to about 100 nurses, and it's scary. I guess what I'm trying to do, Ty, is I'm trying to increase health literacy. I think that's the best way of putting it. And what I mean by that is I think it's only right for people not to get one side of the story. I think it's right for people to understand everything. I want them to understand the benefits of this shot. I want them to understand the risks of this shot. I want them to feel empowered. I don't want them to feel bullied, coerced, manipulated, bribed. And I also don't want them to feel like if they don't get the vaccine or I don't even label this a vaccine, by the way. It's a shot to me because it hasn't earned the privilege of being called a vaccine. But the point I'm trying to get at, and let me talk, I hope we can talk about that a little later as well.
Of course.
But my point is this. I want people to be informed consumers. I want them to know what they're getting. I want them to be proud of their decision. I don't want them to have remorse or anger after making the decision because they were told they had to do it or else. So my point I'm trying to get at is that I'm trying to raise health literacy. I'm trying to raise it among populations that don't have access to healthcare. They don't have access to easy to understand information. They don't have access to even a healthcare system that they understand.
Right.
And so anything and everything that I can do to give them all the information, the whole picture, not one-sided, the whole picture, the more I'm going to do that. So that's kind of what I'm focusing on.
Yeah, absolutely. And yeah, and again, speaking on that LinkedIn event, there was I believe her name was Dr. Smith. I want to say that's who she was. She was in Hawaii.
Jennifer. Yep.
Jennifer
She's
Smith.
a virologist in Hawaii. Yep.
Amazing. Speaking, about her, and shout out to her if she listens. But she spoke about the effects of the SARS-1. So when SARS, if there's people out there that are listening and are too young to remember, I was in my early 20s, I think, during this time, but the SARS-1, I guess you can call it a pandemic. Would you call it a pandemic?
No. SARS-1, I would think would be more of an outbreak.
Outbreak.
Yeah, absolutely.
Okay. So Dr. Smith spoke about how with the SARS-1 vaccine, or the shot that was given for that, the properties of SARS-1 and SARS-2, which is what COVID is, are similar. So the properties of it are similar to some degree. So there's a way there's actually a more responsible way or a better way to come up with a vaccine. Am I correct on that?
Yes and no, Ty. Yes. Let me explain, because this is a good opportunity. Now, before I do that, I'm going to explain what cognitive dissonance is.
Okay.
Cognitive dissonance is a psychological term that basically says your beliefs and your actions have to be in line. And if they're not, then you kind of get into this conflict. So let me make something very, very clear. I have had an unbelievable number of vaccines. You know this. You're a military person. I was a military dependent. Since leaving my dad's house, I also worked for CDC and Emory and traveled the world. And so I've had unbelievable numbers of vaccinations, the traditional ones, and then many, many more.
Right.
I believe in vaccination. I'm a public health professional. I can't be a public health professional not believe in vaccination.
Right.
I believe that vaccination is critical, absolutely critical. However, and this is critical, you have to understand, this is where cognitive dissonance comes in. I can be for the COVID-19 shot, but also be against the way the COVID-19 shot is being used.
Right.
Believe it or not, I know it blows people's minds. It's either you're mandating it or you're against it. No.
Yeah.
That's not true. It doesn't have to be that way.
Right.
Look, it's clearly evident right now that what we're seeing with the data we're being provided, if you are in a high-risk population, someone who is elderly, someone who has pre-existing medical conditions like hypertension, diabetes, and obesity,
right,
that there is benefit to this shot. There's benefit, but not outside of that group. Look, again, I'm going to give you the whole picture. Give me a break. Outside of they start talking about hospitalizations. It's ridiculous. They're skewing the numbers. I don't believe in it. I think it's a lie. But it's clearly evident that this shot does show benefit for the most vulnerable population.
Right.
That's very, very clear. The shot that Dr. Smith was referring to, and you have to understand the technology and the growth between 2003 and where we are now is in science, it's astronomical.
Right.
They failed in the vaccine back then because basically what it showed was something like this. It produced it's not pathogenic primate, it's more like an ADE, where the virus was enhanced as a result of the immune system based on the vaccine that was presented back in 2003.
Okay.
Or beyond that, based on that initial virus.
Right.
Look, most vaccines take between 12 and 15 years to go through a process because they need safety records.
Right.
And anyone who tells you that the conclusion of this vaccine is safe it's just not true, Ty. And the reason why you know it's not true is NIH just funded a project to look at reproductive issues associated with the COVID-19 vaccine or COVID-19 shot.
Wow.
And obviously, if they knew the safety record, they would not be funding research to try and determine what's going on in women,
exactly.
From a reproductive standpoint. So look, we know that there's a lot more to learn about this shot. We know that. That's just a fact. Anybody who says again that's not true is a lie. Again, you also know that this vaccine has caused more adverse events than all other vaccines combined in the 31-year history of VAERS.
Wow.
Now, what is VAERS supposed to do? VAERS is supposed to alert us when there's a potential safety issue with a vaccine. And I'm sorry, VAERS hasn't just raised a flag. It's not even a blip. VAERS has raised, it's almost at Mount Everest at this point.
Wow.
And yet public health leaders and no one seems to be listening. And by the way, the United States is not the only one seeing this. The UK is seeing this.
It's
the
everywhere.
EU is seeing it. Come on. I mean, this is it really, Ty, it really is a point where you start to look as a public health leader, as a public health professional, what is going on here?
Yeah.
I'm in a twilight zone.
That's the perfect segue, because what I wanted to ask you about next was your background. So I got a chance to look at your resume. You said this your resume, which is kind of cool. Appreciate that. But you actually worked at Los Angeles Airport during the SARS-1 outbreak. Can you tell us, are there any similarities between what was going on back then and what's going on now with regard to? I could
provide you. So I was at CDC during that time.
Okay.
And I could provide you documents from CDC that actually says you don't wear masks.
Really?
Absolutely. I mean, I could
Wow.
I was a health educator. That's what I was doing. I was doing health education for the customs agents. Who were
Wow.
receiving planes in from LAX from the Guangdong province.
Mm-hmm.
And the problem is that everybody was wearing a mask, and they were trying to get them to stop wearing masks. And so CDC actually published guidance that basically said, don't wear masks. They don't necessarily work with SARS coronavirus 1. So look, now granted, people will say science always matures and we've learned it's better, whatever.
So now,
but my job was really to get them to stop wearing masks, to put what I basically had recommended is the use of hand sanitizers, standing back, putting a fan behind them, using directional airflow, and using space and distance as you screen the patients coming from high-risk areas.
Social distancing.
Yeah, absolutely. So, but, again, and in fact, look, one of the things that Jennifer was trying to say, I think in your comment, she was trying to say that, look, humans have dealt with viruses
forever,
for a very, very long time, ladies and gentlemen. They just have. This is not anything new. I mean, granted, it's a novel virus and it picks on people who are very vulnerable, but it's not alien.
Right.
We've dealt with viruses. We can deal with, trust me, listen to me, please hear me. We can deal with this virus. If public health professionals, scientists, and healthcare workers start partnering and collaborating instead of fighting with one another, we could really get through this pandemic very easily. If we rallied behind the most vulnerable populations, let the health serve the most vulnerable populations, we could get through this pandemic. If we increased health literacy, if we just started talking to people in terms that they understand, we could get through this pandemic.
Absolutely. I totally agree, and I mean, you're the that's why we brought you on. You're the expert. You're the one who's on the ground at the ground zero.
I'm not the expert. You know why I'm not the expert? Because obviously they instead of listening to messages and people who are saying the same thing I'm saying.
Yeah.
They're listening to people that are saying that the only way out is to get vaccinated.
Right.
I mean, can you listen to what you're saying? Yeah, I want you to realize the logic here. We have a pandemic of the unvaccinated. Hold on. Oh, wait. Okay. What are you saying? And we have people that are releasing. We're in the middle of a pandemic. We're about ready to go into the winter.
Yeah.
The winter is going to, whether it's influenza or it's COVID-19, people are going to get sick and die.
Right.
Every year they do.
It happens every year.
Every year, Ty. Yeah. And you know what the worst part about this whole thing is, Ty? Worst part. We're releasing healthcare workers because they don't want to get vaccinated.
Right.
So hold on one second. So as we are in the middle of a pandemic, and it's going to get worse, because it will during the wintertime, it's going to get worse. We're in the middle of a pandemic, it's going to get worse, and we're losing police officers, firefighters, healthcare workers, first responders. Are you who's leading in this? Are you trying to set up failure? Are you trying to kill people? Because those are the questions that people need to be asked. Are you trying to kill people?
Right.
Because you're really almost asking for it indirectly.
Right. By taking away a person's human right to take this shot, as you pointed out, how I'm going to start saying it, or not, it's that, I mean, it's mind boggling to say the least.
Well, you said something about shot. Let me explain why I call it a shot. And by the way, just so you know, I have received the influenza shot. I don't give that a vaccine name either. And let me explain why.
Because you still get it.
Well, no, but here's the issue. When I was formally trained in public health, I have a master's degree in public health. I am now certified in public health. The definition of a vaccine was very clear. Number one, as a consumer, it was not a risk to me. There is still a lot of evidence that we need to learn a lot more about this shot that we're currently pushing. So that's number one. A vaccine does not pose significant risk to me. Okay. Number two, it actually stops me from getting sick. It prevents illness. This shot does not. Number three, and there'll be people argue, Ty. They'll say, but it lowers your likelihood of. The facts are the facts. I can be fully vaccinated. I could still get sick. Not only can I still get sick, I can also still transmit it to other people. Yeah. I don't care whether it's reduced or not. It doesn't matter to me. It's a vaccine. When it's called a vaccine, when I was formally trained, it was, again, not a risk to you, or not a substantial risk to you. Number two, it stopped the transmission of disease and it stopped you from getting sick.
Right.
This shot does not meet that criteria, as the influenza shot does not either. So to me, I'm sorry, it doesn't earn the word vaccine.
Gotcha.
Vaccine is earned by
Gotcha.
evidence. And this one is clearly not earning that. It does
Absolutely.
show benefit to some people.
Right. To a certain group
Correct.
of people. As
To
you
a certain
pointed
group
out.
of people who need help.
Absolutely.
Absolutely. So
awesome. Awesome. So let's talk about infectious disease behaviorist. So let's talk about what that is. Can you explain to the audience what that is, an infectious disease behaviorist?
So I study, and I'm fascinated by behavior. You have to know that. I mean, if you ever see somebody at an airport watching you, it's probably someone like me. And it's not that I'm a creeper. I'm not watching you in some weird way. I love
voyeurism.
I love behaviorism. I mean, I do. Look, I'll show you. It's just, I can just even do a basic exercise with you, Ty, right now. Okay, are you ready? You know a deck of playing cards, right?
Mm-hmm.
All right. I want you hold on one second. I'm going to show you that I'm doing this. Let me see, because I want your users to be able to see it. So you obviously can't see what I'm doing here, but I want you in a deck of playing cards. Let me make sure that you can't see this here. Bear with me here. All right, there we go. Let's see this. I want you in a deck of playing cards to choose a color, red or black?
Black.
All right, throw that in the trash. You got red cards left. Hearts or diamonds?
Diamonds.
All right, throw those in the trash. Good choice. You got hearts left. Now I want you to choose a category, 2 through 10 or jack through ace.
Jack through ace.
Okay, jack through ace of hearts. All right, now jack and queen or king and ace. Choose another category.
What was it, 6 through 10?
Jack and queen or king and ace.
Oh, king and ace.
King and ace. Okay, now king or ace of hearts.
King.
Throw that in the trash. What do you got left?
Ace of hearts. Ah, nice.
Nice. That's a trick, but look, I love behavior. Like, I love it. And what is really cool is behavior around infectious diseases. How do people behave around a potential risk, around a potential threat? So whether it's in a laboratory, a high containment lab, which is where we teach, BSL-3, BSL-4, I wish I could show you our training lab. We teach high containment lab work. Or it's in a clinical setting with people who have highly infectious patients. What we like to do is we like to make sure, just like the military, it's like boot camp. We like to make sure that when you get done, it's not what you know, it's that you actually do it. Like, for example, a classic example is simple as removing your gloves. People think that wearing gloves protects them, but no, if your gloves are contaminated and you take your gloves off,
you touched them. Yeah.
You could contaminate your hands, you could contaminate your body. So we teach people the skills they need to work safely around infectious diseases, whether it's in a clinical setting or in a laboratory setting. Oh,
very cool. Very cool. And that kind of goes into what I was going to ask you next about your company. So tell us a little bit about Safer Behaviors. What's your company's mission and vision?
Well, I mean, so we have a book, Prepare and Protect. That's really what our company does. It prepares and protects people to work around and with infectious diseases. Now, and
where can the audience get that book?
You can go, well, if you can search it on Google and it pops up. It said ASM Wiley are our publishers, the American Society for Microbiology, the publishers of it, ASM Press. You could go to Safer Behaviors. Just you can look me up. But look, I think that when we talk about what our overall mission is, I'll get spiritual with you, Ty. I'm a Christian guy, and my job is to serve. And I believe in serving. If you need information and you need assistance, I'm going to do my best to try and give that to you.
Great.
I do a lot of free work. I represent right now. I'm with a bunch of lawyers who are representing small businesses that lost everything as a result of this pandemic. There are lots of major lawsuits that we're waiting for. If President Biden chooses to drop the OSHA mandate for businesses over 100, get ready. I'm throwing everything out of my schedule and I'm writing declarations, a lot of them for many lawyers. Awesome. So no, I think that the reality is that I kind of go where God takes me, to be honest with you, Ty.
Awesome.
I don't know where my next paycheck's going to come from or my next business opportunity. Who knows? Maybe they'll come from from this discussion with you. But the reality is that we do our best. If you have questions about people working with or around infectious diseases, or even policies that you're going to write for your workforce specific to the COVID-19 shot. And I'd be very careful, by the way. Big Pharma is not getting sued, and neither will the government.
No.
But the employers will. And so you get ready. You just get, I already know lawsuits are mounting, but you get ready. If you think that a president standing up and saying a mandate could come, but never does, is going to give you ample protection in front of a jury from a staff member who was forced to take the vaccine or lose their job, and now they have lifelong issues. Maybe they've lost their life. Maybe they can't have children. Maybe they have psychosis or something like that. I'm sorry. If you think that the politicians are going to support you,
wow,
the jury is going to hang you. They are going to hang you. So you better be careful. That's a risk you should think about long and hard before you impose a mandate that isn't illegal, but certainly from a civil standpoint, you could be held accountable for. So
absolutely. That I couldn't say it better. Couldn't agree more. So that's it, man. I want to wrap up with just one last question for you, and this is gonna be a doozy. So
oh good.
So if you were in charge for one day, like you were that person on the Supreme Court or whatever, whoever's calling the shots, I don't know who it is, and I don't really even care, don't even want to know. But if you had that opportunity to call the shots for one day and say, worldwide, this is what we're going to do about this pandemic, what changes would you implement?
So let me give you, I'm gonna do this in a 3-step process.
Let's do it.
Okay. The first thing that I'm going to do is I'm going to give Dr. Fauci a nice retirement. I really am. I am. I'm going to give him, he's deserved it. I mean, look, the man has had an unbelievable career in public health. I know a lot of critics out there. I've always valued Dr. Fauci. I do not value him right now. I do not agree with a lot of what he's doing, but I would recognize his contributions, and I would say, please enjoy your second in your new life. I would definitely get rid of the CDC director. It is clearly evident that politics have completely compromised the leadership capacity at CDC. I would get rid of that aspect. I would listen to my committees, and I would ensure that any future messaging that goes out is designed not to influence people, but to simply inform them to make the best decisions they can make for themselves. That would be step number one, meaning I would no longer play along with a narrative. I would give people the information they need to make good decisions and make sure it was understandable, easy to act upon, and move forward on. And unfortunately, our public health leaders have not done so. They have been compromised, in my opinion. Okay, second thing I would do, I would protect the most vulnerable. Look, this pandemic is real. There are people dying. There are people suffering.
Absolutely.
And there are people that need help. And we need to protect. We need to rally behind these individuals. Absolutely. We need to make sure they do get the shot. We need to make sure that they do get boosted. We need to make sure that they feel empowered to take control themselves. We need to treat this virus early. I'm sorry, Ty, coming in and having a positive test and not getting any early treatment and just getting this, we'll come back to the hospital when you can't breathe and we'll take care of you. We can do better than that.
Yeah.
We can do so much better than that. So the second step I would say is we're going to rally around the most vulnerable people. We're going to ensure that they have the resources, the shot included, to protect them. And we're going to prevent and give early treatment before people get so sick they have to go to the hospital. That's the second step.
Okay.
Let's see. Now, again, I have unlimited resources because I'm the big head honcho.
Yes.
My number 3.
Yep.
I think if I were to say that my third step, golly, I think the third step that I would impose is I would say there will be absolutely no mandate, that we will ensure that people's rights in this country are respected. Look, Ty, I have, and I'm a coach and I'm a counselor on the side as well. I have nurses who want to be a nurse so bad, women who want to be a nurse so bad, that they were mandated to take the vaccine at 21, 22 years old, who went and had their eggs harvested so that and frozen, and they're paying for that process, and they also paying to store them so that if they choose to have a baby and they have this vaccine and something goes wrong, they're still able to be a mother one day. I had a client of mine who gave me permission to share this, where she's a mother of three, a single mom of three.
Mm-hmm.
She just got so tired that she decided, I'm just going to get the vaccine because I cannot feel like I'm going to lose my job. And I asked her, how did that make you feel? And she said, Sean, I was raped in college. And I said, oh my gosh, I'm so sorry to hear that. And she goes, and I hadn't felt that way since.
Wow.
Getting this vaccine made me feel like I was being raped all over again. I'm not making, this is real, folks. You are causing people to give up careers, professional identities, because they're choosing not to take a vaccine that promises so much but delivers so little.
Right.
And I am so sorry. This is morally and ethically wrong. So Ty, my third thing would be to end all mandates and make sure that people had a choice and the information they need to make the decisions. Because again, this shot does bring value, but it brings value to a very specified group of people, not to everyone. And so to mandate it as if it does, and to mandate it as if it's the only solution, it's wrong, it's unethical, and it's immoral. Those are my three things. So.
Very, very much so. As someone myself, I had COVID, I recovered. Of course, I'm young. I don't have underlying health issues. Yeah, we need, there definitely needs to be some reform when it comes to this. And shout out to everybody out there that have suffered through this, had a loss because of this. We're not here to trivialize anything that's going on. This is a serious subject.
It is.
This is something that is affecting everyone from all different backgrounds, whether race, socioeconomic, however you want to classify it. It's affecting everyone. And I just want to see something that makes sense happen. What's going on right now doesn't make sense.
Absolutely.
The fact that I was just watching TNT NBA last night, and the NBA commissioner was on, and he's telling one of the players he needs to go get vaccinated because he's putting his family at risk. How can you make that statement? How can you make that generalization when we don't know what, how this whole thing is going to play out? So when you see things like that and when you hear things like that, it just really, really, makes you think. And that's why I'm so blessed and so happy to have had you on our platform to be able to talk about this candidly. And yeah, I'm totally with you, and I'll be right behind you, saying, yeah, definitely. I agree with Sean.
Thank you, Ty, man. I appreciate you so much. And I thank your listeners too. And please, if you do find this to be of value, share it with folks.
Of course.
And if you have any questions, please, Ty, feel free to put up my contact information. I'm happy to answer any questions people have.
Yeah, for sure. And on that, I do have one more question. Where can people find you on social media?
Oh man, well, I'm on LinkedIn. It's just my name, Sean Kaufman, and that's pretty much. I mean, Facebook has some safer behaviors, but just look for LinkedIn. I'm on Twitter a little bit as well, but LinkedIn or direct contact. That's really the best way to reach me. So
okay, yeah, we will definitely put Sean's information in the caption for the show, so you can reach out to Sean via those platforms. So thank you so much again, Sean. I really, really appreciate having you on. Looking forward to having you on again real soon, especially hopefully at a point where some things that you mentioned that make sense start to happen, and we can talk about that. We can celebrate that. That's the day that I'm looking forward to. A day where we can again make our own decisions and our own choices, based on our own personal needs and not based off of mandates.
Yeah. Hey, Ty, how about a day of compassion? And what I mean by that is look, as you said, and I agree with you, we've lost a lot of people,
Mm-hmm.
and we're going to lose more. More people are going to die. And my heart goes out to them. I work hospice. I've worked with people who are dying from this disease. I love hospice. It's the greatest thing in the world.
Mm-hmm.
But just because you have compassion for those who are dying doesn't mean that you can't have compassion for those who are living.
Right.
And those who are living and they morally and ethically have an issue with this mandate. Mm-hmm. So much so that they're giving up careers. They're being fired. They're being terminated. If you are demonstrating compassion, meaning you're choosing to suffer with, that's what the Latin word compassion, 2 words, suffer with. Compassion, we can have enough compassion for everyone here. We can focus on those who are getting sick and dying, but we can also focus on those that are struggling with this mandate. And that's really the day I'm looking forward to.
Yes, sir. Perfect way to end that. And again, thank you so much, Sean, for being on the show. Really, really appreciate it and can't wait to have you back.
Thank you, Ty.
All right. So just going to end the show with some housekeeping items. Of course, we're on Facebook, we're on Instagram, we're on Twitter at 2 Minds Connect. You can find us there. Shout out to our sponsor, Canyon 3D, greatest 3D printing company in the world. And again, thank you so much to our guest, Sean Kaufman, for being on the show. We'll be putting this show out very, very soon, so keep it locked. So from myself, from Sean to Benny, we want to thank everyone again for listening, and we can't wait to have the next episode. So to everybody out there, thanks again, peace and blessings, and have a great day.